Good afternoon, and thank you for listening to my second audiovisual journal. The program I'll be covering is a program that's near and dear to my heart, something that I very much have bought into and enjoy being a part of. It's the National Guard Psychological Health Program. The program covers 50 states, Washington, D.C., Guam, Puerto Rico, and Virgin Islands, each of which have a National Guard component. The program itself exists after a 5 year study from the RAND Corporation, a nonprofit global policy think tank and public sector consulting firm. The study started in 2015 and was completed in 2020. The study found that by placing one clinical social worker within a wing, completed suicides dropped to zero for all airmen within that wing, compared to those wings that did not have a social worker. This success was contributed to early and often prevention and intervention, social integration, with the social worker walking about each squadron, and engagement at the highest and lowest levels, from the lowest airman basic to adjutant generals themselves. This study came from the United States Air Force initially, and so did the program, filtered to the reserves, and then eventually made its way to the National Guard. As such, because most funding came from the Department of the Air Force on the federal level, the program continues to only exist in the Air Force and subsequently on the Air National Guard component of the National Guard. The overall program is unique in that it utilizes both state and federal funds in a very complex mixture of resource allocations every year. The social service programs that are offered are funded by federal funds, state funds, county funds, and also uses nonprofit resource linkage services. Each state and territory has at least one director of psychological health, also known as a DPH, that manages these programs for the Air National Guard, with the goal being one DPH per wing. For example, in Oklahoma, we have the 137th Special Operations Wing and the 138th Fighter Wing. Theoretically, there would be one DPH each at each wing, but due to budgetary constraints, I cover for the entire state, including the airmen at the 137th, the airmen at the 138th, and airmen at Joint Force Headquarters. So, what does the program do? The program itself utilizes the Director of Psychological Health to assess, diagnose, and treat those with mental health or substance abuse issues, including but not limited to emergency detention or involuntary psychiatric holds. The Director of Psychological Health completes routine mental health evaluations, pre and post deployment evaluations, evaluations before going to Survival, Evasion, Resistance, and Escape School, also known as SEER, and assessments for evasion and conduct after capture, also known as ECAC school, placement in outpatient services, and providing ongoing outpatient therapy with clients in need. The DPH serves as a resource for the wing commander, the squadron commander, and first sergeants, in addition to line level airmen, both on active and reserve statuses. The program itself is great in that it allows the DPH as a civilian to report to and work with all ranks within the Air Force reserve subcomponents. I can sit down with an airman on the tarmac or walk into the wing commander's office and I'm expected to be there. I'm able to communicate with everyone regardless of their status and communicate with people at the National Guard Bureau and the Pentagon, but also state resources at the Joint Forces Headquarters. My position is completely federally funded and I'm a GS civilian. Programs and services are created by each DPH tailored to their state and their respective wings. For instance, in Oklahoma, we have large issues with alcohol abuse and domestic violence, in addition to having those issues among Native American tribal members that are also part of the Air National Guard. Accessibility is a strength because it's just me with unlimited access, being able to be a hub in the network, going to various offices across the state, speaking to everyone I can, both in state buildings and federal installations. My goal overall is to increase awareness of the program and accessibility by all service members, regardless of rank or status. I seek to improve individuals' lives such that they're performing on the job, do not allow small problems to prevent them from completing their enlistment or commission, and hopefully keep people in the uniform having a positive experience while being in uniform continues to be a part of their professional identity. Unfortunately, the same strengths are the challenges. Because of the nature of programs and services being in nonprofits, state agencies, federal agencies, and county agencies, I often find myself lost trying to navigate it. I have great support staff that are helpful in helping me find people that I need. However, it can be daunting when a service member has just lost their child and needs to have funds to bury them, or they just lost their house. Sometimes those resources just aren't available. Often, because I have open communication with so many people of all different ranks, I also have to be very political in my response to people instead of just being genuine. Lastly, for the typical guardsman that only drills 1 week in a month, they do not have insurance and are not provided TRICARE Prime to cover their medical, mental health, or substance abuse treatment. Often, it's my place to tell a service member there is no immediate help available for them. This is a large gap in service provision we are trying to actively solve. Most importantly, from a Christian perspective, in Proverbs 3:27 says, "Do not withhold good from those to who it is due when it is in your power to act." My job here is to increase accessibility to services, be a shoulder for an entire state of service members to lean on, bringing people of a variety of backgrounds together through complex networks of service provision, and most importantly, being of service to those that are desperately in need.